Thank you all. Welcome to our daily briefing, COVID-19 briefing here in Chattanooga. We're here today for our briefing, and we have been meeting with local leaders, Mayor Burke, Mayor Coppinger, Becky Barnes from the Health Department, Todd Gardenhire, Senator Gardenhire, Representative Yusuf Hakeem. And we have been talking about how it is that we in the state and in this community, that how Tennesseans can work together to address this crisis that we have, COVID-19, that's presented itself and is moving its way through this state and is creating tremendous hardship from a health crisis standpoint and an economic standpoint. And so today was an effort to continue to work together. We have had an incredible working relationship along the way in the past several weeks, but we wanted to be here in person, face to face, to meet together. We brought our unified command group in our governor's office. We've put together a unified command group weeks ago that is specifically created structurally to target this COVID-19 pandemic. Here in our state, it is headed up by Stuart McWhorter, who was the previous F&A commissioner, but is now the director of our Unified Command Group. We brought together Department of Health, Department of Military, and TEMA. And today, by the way, I have officials from all three of those together here to answer questions along the way. But our Unified Command Group is working with leaders here in Chattanooga, in Hamilton County, and in the region to do what we can to mitigate to the greatest degree possible the damages that our state might have and will have as a result of COVID-19. By the way, and we're here at UT Chattanooga, and I want to thank UT Chattanooga in particular, along with many others in this community, for the efforts that they have made to come together. This is something that Tennesseans are going to do together. We're going to address this challenge before us individually. I've said that Tennesseans must individually have and take responsibility to stay at home, to stay away, to do your part, to stay apart. This is going to be best met because of the efforts of every single Tennessean, and we need you to engage. We need you to follow guidance. We need you to socially distance, because a virus that transmits from social contact can only be slowed by reducing that social contact and staying away from people. But it also requires institutions like UT Chattanooga, who have been instrumental in helping us to develop and create and produce face masks, for example. The Hamilton County School District has been very helpful in that effort as well. Procurement and creation of, manufacturing capability and distribution of personal protective equipment is part of the battle. It's part of what we're working on in our Unified Command Group. I'm pleased that we have made shipments through TEMA to every single one of our 95 counties. Testing, because there is little known about this pandemic and how best to attack it. We know social distancing does, but we also know one other thing we know is that the areas that have tested the most have had the best success with slowing the spread. And so I wanted to be a state that was doing everything we could to test, and we are one of the top testing states in the country. We test significantly more per capita than any state in the South. And I say that not only to applaud the efforts of the communities across this state, including this one, in their efforts to provide testing, but to tell the public, your state is doing everything it can to have the best results possible, and testing is one of those ways to do it. And we're also very encouraged about the prospects for significantly increased testing in the days and weeks ahead. I said earlier that it takes individuals, it takes institutions, it takes the private sector, companies like Blockley Dental, Alliance Physical Therapy in Cleveland, Cleveland Associates, companies in this region, private sector in this region, who have made contributions. There are many more, by the way, and we thank you for that. We thank you for your contributions. We thank you for your offers to produce. So we have created a partnership with Launch Tennessee, and we opened up an opportunity through their website for any company, any private sector, any nonprofit that wants to participate in the production of, the distribution of, the development of supplies and equipment for this, that they can work with Launch Tennessee. We've had about, I think, 459 registered vendors through that process just in the last several days. And it's particularly helpful when we have companies. Chattanooga EPB has been helpful in providing wireless hotspots for educational purposes. It's particularly helpful when the private sector in a community engages, and we encourage that engagement in a greater way. As I mentioned the private sector, I want to say something about businesses, small businesses, entrepreneurs who have had to close their business as a result of this COVID-19 pandemic. It's incredibly painful to make decisions that require a company to close their doors. That means that people are going to lose their livelihood, they're going to lose their income, families' lives are going to be economically devastated. It creates a ripple effect of challenges in mental health. We have rising challenges in domestic abuse and child abuse as a result of the strain and the stress put on families when we have, as we have in this state, over 200,000 unemployment claims filed in the last several weeks. I just want to speak to business owners that have had to close their doors and those that are losing business significantly as a result of this downturn. We want to do everything we can to be helpful. We've said that to individuals through TANF funding and SNAP funding and unemployment benefits and efforts at providing targeted relief for individuals, but we intend to do that as well for businesses, because we want to help you survive this, even through a closure, to have hope for getting back on your feet again as a business in the future. There's a great deal of work being done on the federal level in partnership with the state to provide through the Paycheck Protection Program that just went live today, that provides relief for businesses as they face layoffs and face closure. So I just want to say, we know that it is incredibly difficult to make decisions that have required businesses to close. And not only are we working hard to mitigate the health crisis and the effects of this for individuals and their health situation, but we're working really hard to mitigate the damages to business as well. When the clouds clear on this and we get beyond it, we want to be there on your behalf to help you get through, whether you're an individual, whether you have faced this health crisis, or whether you are a business. I wanted to report today, because I haven't made this report publicly yet, but we have in our state 3,067 cases. We have performed 37,839 tests, and we have lost 37 Tennesseans to COVID-19. That last statistic is the one that I want to use to remind people that this is an incredibly serious threat that we face. We will get through it, and I have great hope that we will get through it in a way that mitigates the damages, but make no mistake, the damages are severe, and lives of Tennesseans have been lost. That is why it is so important for every single Tennessean to heed the guidance. It's so important for people to do their part, to stay at home, to stay apart, to socially distance, whatever that means for you, and however you can make that happen. We need to make that happen because the lives of Tennesseans depend on you doing that. I want to open it up for questions. I want to remind everyone that we have with us Unified Command Group to answer your questions. But I'll make one other comment before we go into the question period. Much of what we talked about today was surge and how we are preparing for that surge. We have been looking at sites across the state with the assistance of the U.S. Army Corps of Engineers to select sites to ramp up bed capacity in our state. We're actually going to use the Chattanooga Convention Center site to add additional beds to the hospital capacity in this state. We can talk specifically about that in the question and answer period. We're working together with local providers here to make sure when that surge happens, we have done everything we can to prepare for it. So I'll be happy to answer questions around that. Yes. Part of what the question is, how can we improve testing in Hamilton County? Because the state is a leading tester in the country, and the comment was that Hamilton County wasn't testing as much potentially as they could be. We talked specifically about that today with the leadership from this community about how we can better coordinate the capacity, because we do have capacity for testing here. We just need to make sure that all of the medical providers, all of the hospitals, the health departments are coordinating our efforts to ramp up that testing. We have a limited supply of tests. Everyone that wants to get testing can't get it at this point, but we believe that most folks who need testing right now actually can have access to it. We're seeing vastly improved times in the turnaround of those tests. So your local leadership here is very focused on how it is that we can have this community, this county, this city, and even this region more engaged in testing. But there is a lot of testing online here. I mean, ramping up and coming online in this community. There's a real concerted and good effort for that, and I think we're going to see much better results all over the state and in this community as well, just in the next coming days. Yeah, so the question is, when and how did we choose to make decisions around our stay-at-home orders? I have always believed that the best way to make decisions is with information, and there are a lot of varying opinions. There are a lot of varying pieces of data that look really different. There's wide variety in the data out there around the best way to accomplish the right results. We all know that social distancing works. It's incredibly important. So how we get people to socially distance and how we move a population along to do that it's very important. We spent a lot of time making decisions about what is the right time for the right steps. We watched data. And I think one of the data points that I talked about the other day was the movement of traffic in our state. The Tennessee Department of Transportation has information on traffic flow and all the time. So we decided to take that information, look at it, and we saw where Tennesseans were traveling less and less and less. And before any stay-at-home order even, the encouragement and the urging and the reminders and the seriousness of it and the weeks of saying we need to stay home, we saw it working. And then there came a point where it stopped working and where the turn started going back the other direction. And we saw Tennesseans beginning, now not Tennesseans, some Tennesseans, because for the large part, people are doing what they need to do in this state. But we saw it change, and that was dangerous. It was very concerning to me, and that data combined with the activity of that cell phone data, by the way, is publicly published by somebody else. We just watched their data, and we saw that decline for weeks at a time and then start back up. So for whatever reason, the behavior of Tennesseans was changing, some Tennesseans, and that for me was the time to make a decision. Again, I think the best decisions are made with information. When I saw information, I made a decision and moved that direction. Yes, sir. I think I'll let one of our team members from our Unified Command Group answer that question. Patrick, the question is, the Chattanooga Convention Center that we've identified as a location, have we determined yet the number of additional bed capacity? And talk just a little bit about what kind of patients will be in that facility.
Yes, sir. And sir, since you've been speaking, we just signed the lease agreement with the Convention Center, so that's done now. So what we're looking to house to increase our capacity for beds is 350 COVID positive, low acuity patients. So trying to group those types of patients that need hospitalization but don't need a high acuity care. And so that's how we're planning this. We've done that after having discussions with New York, both hospital and emergency management and also public health personnel in New York, California, Washington, and in Illinois. And so again, low acuity COVID positive patients, 350 beds is what's planned now for the Chattanooga Convention Center. And we'll continue working on that. The lease agreement signed now since I think right around the time you started the press briefing, sir. And that's what we're looking to do. And that's just one. So ideally, we won't see any patients, right? Ideally, people will stay home. These non-pharmaceutical interventions will work, and we won't get to the point where we exceed capacities in the existing healthcare infrastructure. So ideally, we won't ever see anybody. Ideally, we'll do something and we won't see patients. But we're planning like we're behind now. That's kind of what we're working with, that kind of urgency, and we're trying to bring those kinds of assets to bear.
But when will that be completed?
Between 15 and 21 days. So depending on what kind of complications they come across as they're retrofitting structures. It would be some sort of, Dr. Jones, yeah, thank you.
Why don't you just identify yourself? Yeah, that'd be great.
I'm Tim Jones. I'm the Chief Medical Officer at the Tennessee Department of Health. And essentially any patient, whether they come in through an emergency room, physician, through a clinic setting, if they're deemed by a medical provider there to need hospitalization, then they'll be triaged to the either existing sites or the sites that are rapidly being built up.
Yeah, there are a lot of models, and it's very difficult to know what models are going to actually most closely predict the outcome because the models show widely varying results. But we're currently working off a state model that, and we hope to refine that model, by the way, as we get new models. There is a local model here that we're trying to coordinate with the state model, because our model is a statewide model. It doesn't take into account what's going to happen in individual regions, but we're working on that as well. And let me just say too, there is a lot of guesswork in modeling. There is a lot of unknown about this particular virus and how it travels and how rapidly it travels. We're learning a lot as the weeks unfold, but there is a lot that we do not know about it, and those target dates oftentimes move. Right now we're looking at a surge across the state, collectively across the state, sometime around the 3rd to 4th week of April. But I think the specific model had that surge on the 21st of April in the state. But we're actually performing a little better than that model as of today's date. So it means that we don't really know when the surge is, but we are trying to get these beds up and running and available within 3 weeks, so that we can have the capacity we need by the time the surge comes. So a couple things. The question is how many more, and does it get us to 7,000? So we're going to look at a number of sites in every major area in the state, and the most important thing we could do is get the first site up and running in every place, right? So we need to get beds online as quickly as possible, and that's what we've done. That's why we've signed a contract here. We're going to get started on that one. Then we begin to get with local officials in a greater capacity. We've already been working with the Tennessee Hospital Association, but work more closely with local providers to determine what their bed capacity is, what their surge plans are, and a lot of that work's already been done. The Department of Health is working on that, the local leadership here, both mayors. But as our responsibility was to get started on the overflow, and now to pull in the local providers and say, what do you believe your capacity is? How can we supplement that so that we can collectively have a goal of reaching that 7,000 beds? So the state's not going to build out 7,000 beds, but between the providers and the state, we intend to find those beds. Part of that happens because we've suspended elective surgeries and procedures, and that reduces the number of utilized beds in an existing facility. All that has to be taken into account as we calculate the surge. Yes. Yeah, so there's federal guidance from the federal government that gives broad descriptions about what is essential for the infrastructure of a community to continue to operate, and that's how those decisions are made. We also looked at a wide variety of states across the country that were defining. A lot of this work, it's new. No one's ever done this before. So we communicate with a lot of other leaders in a lot of other states. I talk to governors on a regular basis from one end of the country to the other, from Democrat to Republican to rural governors to states with huge dense populations, all trying to find, with an effort to find what we believe are the best practices. That was the process we took to define what was an essential business, starting with guidance from the federal government. Yeah, so the question is, where are you going to get all the healthcare workers? And because we know we're going to need, there's a number of things we've done, and I'll let Dr. Jones add to my comments. The first thing we've done is work really hard to change the regulations around licensing and scope of practice for medical providers and for clinicians and for those who work in the healthcare industry. So if we broaden the capacity of a healthcare worker, we broaden the responsibilities that they can be allowed to perform as a result of changing the licensing requirements or the regulations around that provider, then we bring on board more workers. There are people that would not have been qualified to serve in a particular capacity, but we've changed the rules. And we changed the rules in a way that provides for safety, but also provides for a greater pool from which to reach. We've also created a portal within the Department of Health and begun a very aggressive outreach program. And I would say it right here in front of anyone that's watching in this community. We need healthcare workers. I think healthcare workers know that, but we want them to know that we have reduced regulations that will allow for those who might not have otherwise thought they qualified to work right now in this environment. They might be able to work. We're also utilizing our colleges and universities that have students that are significantly far along in their training to be able to actually engage in providing care that they would not have otherwise been able to provide. But that portal allows healthcare workers from around the state or anywhere else to engage and to provide information on their willingness to do this. The other way we do it, and we are currently doing this, is creating a platform that provides information around the pool, the statewide pool of workers that we have available. Because what we expect might happen is there will be a time when we need more healthcare providers in Nashville, and then as that diminishes, because the surge in Nashville may actually occur differently than the surge in Chattanooga, we don't know that, but we think it might, then
Yeah, so the data is changing constantly, as you can probably all tell, and I know it's causing a lot of confusion. There's data now to show or indicate that maybe this virus can be spread just by talking, in addition to sneezing and coughing. So, and because of that new data, there's a recommendation that maybe there's benefit to covering our mouth. Doesn't mean you need to wear a full-blown mask, but just covering with any type of a scarf to prevent asymptomatic transmission of the virus.